All right, so I will be talking about how my dissertation research in basic neuroscience connects with public health policy specifically aimed at mental health. So we have a problem in basic neuroscience research right now in that there is inequality in how males and females are represented as subjects. In fact, a majority of scientific studies focus exclusively on studying the male brain under the assumption that what we learn in the male brain will be true for the females, and we're actually doing a disservice by not including female subjects. And it's not simply a matter of equalizing the number of male and female subjects we're studying. We also need to respect the fact that there are unique female biological events, such as pregnancy and postpartum, that do affect how diseases present, as well as how diseases can be treated, especially when there's such biological changes. And in fact, the brain is susceptible to these changes during pregnancy and postpartum. In fact, during pregnancy, brain volume actually shrinks, and then after a woman gives birth, brain volume slowly returns to its preconception size. And not only are there these big changes in the brain, there are also much more detailed changes that are happening in the brain as well. So it may not be surprising that there's an increased risk for mental health issues at this time. And in fact, it's estimated that approximately 15% of mothers suffer from postpartum depression, and nearly half these mothers are actually experiencing depression for the first time ever in her life. So there may be something unique about the biology behind pregnancy and postpartum that's increasing risk for depression. So what my project in the Public Scholars Initiative focuses on is how can we better understand postpartum depression. And so I'm analyzing the current framework that British Columbia clinicians use to approach postpartum depression, and I want to understand how basic neuroscience research can help fill in the gaps in our understanding of this disease. So what I'm focusing on is in treatment options, and we know that there are some treatment options such as talk therapy that are effective, although they are costly. On the other hand, prescribed antidepressants are much more cost-effective. However, these prescribed antidepressants, such as Prozac, do pose some problems in pregnancy and in postpartum. And these drugs do cross the placenta and remain active. They also can enter the breast milk and then remain active. And in this way, the newborn is directly affected by antidepressants. And as of right now, the scientific literature cannot say for sure what are the long-term effects of these newborns being exposed. But neuroscience research has these tools in terms of animal models of disease, and in this way we can start to understand the biological mechanism behind postpartum depression, as well as how different types of antidepressants can work in these models. And we can also understand brain, and we can understand behavior. And now it might seem somewhat counterintuitive trying to model depression, a very subjective mood disorder in humans, in a non-human species like rats. But when we look at the clinical symptoms surrounding depression, there are actually a number of physical changes that happen with depression that are easily quantified. So for instance, changes in sleep or body weight or fatigue can actually be easily modeled in rats. And we also have the advantage of an accelerated timeline when we're studying rat models. So the postpartum period is just 3 weeks in rats, and also the time it takes to age a rat pup to adulthood is just another 8 weeks. So we can start to lay the foundation of understanding what are the long-term effects of maternal depression and its antidepressants. And what we're finding is that in my own dissertation research, as well as in surveying the literature, that there does seem to be something different about the maternal brain that is not as responsive to antidepressants. And in fact, the very few clinical studies that are explicitly studying this suggest that there actually doesn't seem to be any better of effect of using an antidepressant than a placebo. And even more concerning, it seems to be that exposing mothers to antidepressants does have long-term effects on the adult offspring when we look at the preclinical literature. So it is linked to increased anxiety-like behavior in adult male offspring, but not in females. So there also needs to be consideration for studying males and females in this regard. But there does seem to be some hope when we look at other types of antidepressant interventions. So for instance, exercise seems to have some protective effects on maternal mood. But this is an exciting line of future research, but we also do need to understand better how we can increase access to exercise-based interventions in the community. And so what I'll be focusing on is how we can take this information, and then I'm going to put it together in a policy brief so that funding agencies can be more aware of the fact that we don't need to just urge scientists to use males and females, but we also need to take away that there are unique physical events that happen in males and females, such as pregnancy and postpartum, and we need to better understand how these factors factor into mental health issues. So with that, I would like to conclude by saying that we need to advocate for women's health research by including female research subjects, and that basic neuroscience research can be a useful tool for studying brain disease and mood disorders, and that neuroscience research needs to support equity to promote brain health for everybody. Thank you.